Hey everyone, it's Jessica with Montana Family Pharmacies, and today I'm here with Pharmacist Josh again, and we are going to be talking about allergies. And so it's time to start thinking about allergies and being aware of those symptoms and the things that you can do to treat it. So what are some of the most common allergy symptoms, and what do you recommend for how to treat them?
Are you ready?
I'm ready.
All right. You ready to do this, Jess?
Yeah.
Let's give you the rundown on allergies. So basically the most common side effect or symptom that people have with allergies is going to be the runny nose, sneezing, itchy, watery eyes. The easiest way to kind of treat your allergy symptoms is with an oral tablet, taking something by mouth. So probably the two tablets that I recommend the most are typically the Claritin or Allegra.
Okay.
The reason I recommend them is because we've got...
I don't know why that seemed so funny, but it did.
Because they have generics, low-cost alternatives. So nice thing is they're each once a day, and they're non-drowsy. So you take them in the morning, they'll last all day long, and they're not going to totally relieve all the symptoms, but they're definitely going to take the edge off the symptoms, especially the runny nose, that sort of thing, the itchy eyes, the watery eyes. Definitely going to help improve those symptoms for you. So we've got Claritin or Loratadine. That one's probably your best cost alternative and a great product to start with. If that one's not working or you're not getting the relief that you would like, then I would suggest going to the generic for Allegra, which is fexofenadine. It'll go by lots of different names, but you'll see on the box where it says generic for Allegra. Again, nice thing with that, 24 hours, very potent. These actually used to be full, only available by prescriptions, and so these are the full prescription strength form. They're just now available over the counter.
Okay.
Again, very low cost or reasonably priced, and great place to start for your allergies. The nice thing with allergy medications is that if one doesn't work, we have plenty of other options. So our next option is going to be Zyrtec or cetirizine. Again, name brand generic, more expensive, a better priced alternative. Zyrtec, another great product, full prescription strength as well. The only thing with this one is sometimes it can cause some mild drowsiness or sedation for people. So if you're going to take it, sometimes evening is a better time to take it.
Okay. So do you recommend the other two before, and if they don't work quite enough for somebody, then you'd say give this a try?
Mm-hmm. Yep, that would be the next option that I would try. Primarily just because of cost and convenience of taking it. So
Okay.
We also have Xyzal. This is one of the more recent ones, more potent ones to hit the market. No generic available on it yet. Still fairly expensive, but another really good option for people. Causes less drowsiness and sedation than the cetirizine or the Zyrtec. All of these are just a once a day formulation and can be very effective at, again, relieving some of the symptoms such as the runny nose, itchy, watery eyes, and sneezing. Okay?
Okay.
Last but not least is Benadryl. Everybody, they think of allergies, they think of Benadryl. Really, I don't use Benadryl that much or recommend Benadryl that much because it really only lasts about 4 hours. And it causes quite a bit of drowsiness. Mm-hmm. So about the time that it kicks in, it's already starting to wear off. You need to take another one. You tend to be pretty drowsy or sedated. So it is very potent. So it can definitely help really knock it out, but not for very long. So it can be a great option for certain things, but I tend to use this one more for if we're having like an allergic reaction. It might be a better choice for that, where we don't care if we're really drowsy or tired, and we'll have to take it multiple times a day, which is where it's less convenient and more side effects, but can still be very effective at treating different allergies. So one thing that I like about using tablets to treat your allergies is that it gives you kind of that full symptomatic allergy relief. So it'll kind of hit on multiple symptoms at once. So it hits on runny nose, the eyes. Sometimes you'll get draining down the back of your throat and cough, so it can actually help relieve some of your cough if it's caused by the postnasal drip. So the tablets are really good to get just the overall symptoms. Sometimes we don't necessarily have all of the symptoms, and we want to just treat one of the symptoms, whether it be the nasal congestion, maybe the runny nose, or the itchy eyes. So we have some options to treat just those symptoms as well.
Okay. So what are some of the things that you would recommend for just nasal congestion?
So nasal congestion is typically probably one of the most annoying parts with a lot of allergies. People get congested a lot and they actually think that it's a buildup of mucus in there, but it's actually inflammation. So the nasal bed gets inflamed and swells up, and then that is what causes that pressure in there, and the inability to be able to breathe easily is because it's so inflamed in there. So for nasal congestion, these are my best recommendations. These are all nasal steroids. How a nasal steroid works is they actually get into where that inflammation is and help shrink that down. So they actually not only just mask the symptoms, they're treating the cause, which is that inflammation, okay? These used to only be available by prescription. Now they're available over the counter. Fantastic options for us. So as prescriptions, they were probably over $100. Now we can pick them up for $20, $25 or less. Kind of our different options. Flonase, Nasacort, and Rhinocort, they're pretty much all the same. It just kind of comes down to personal preference. If you don't like one or you don't like the smell of one, you can always go to another one. The nice thing is that you can actually use some of these in kids as 4 years and older. I'll even use them in my kids sometimes if their symptoms are real bad. So Flonase is nice in the fact that it too has a generic. So it's the fluticasone, and that will just give you additional kind of cost savings, and it's a great product. With the Flonase, it's one spray in each nostril, just one time a day. With the Rhinocort and the Nasacort, you can actually do 2 sprays in each nostril once a day for the first week or so. As your symptoms start to improve, you actually just scale that back then to 1 spray in each nostril once a day. So with the steroids, when you do them, I do recommend having like a glass of water afterwards, just rinsing your mouth out. Sometimes when you sniff in, sometimes it can get in your throat, and some people will feel like a scratchy and irritated throat. So just to help minimize that. But all of these are great options to help with that congestion. So.
Okay.
Sometimes if we're looking for something other than going the steroid route and we're looking for something more natural, Zicam has a homeopathic product here.
Cool.
Kind of works on the same thing, kind of that anti-inflammatory approach, just to kind of help with any inflammation there, help relieve some of those congestion symptoms. I really like homeopathic and natural things. There can be some, natural and homeopathic things like this can be very effective. They recommend 12 and older on this one, just because it's not really tested in children younger than that. So I also like to use this, which is Aquagel. It's actually infused with eucalyptus, which is a natural anti-inflammatory as well. So the nice thing with this Aquagel, what it'll do is it's a nasal moisturizer. So you can I usually put just a little bit like on my pinky or on a Q-tip and put it inside of each nostril and then massage it into place. And so what it'll do is it will create almost like a mucus barrier in there, which will hydrate your sinus cavity. Mm-hmm. It'll decrease the inflammation, and then it'll also help catch those allergens that we're breathing in, which are causing the inflammation. Oh. So the nice thing with the Aquagel is that it lasts 12 hours. So you typically just have to apply it, twice a day, and you'll get really good nasal congestion relief. This one's specifically designed for allergies with the eucalyptus in it. So the one thing that I don't recommend very often is good old Afrin. Afrin or any of the other nasal sprays were the ones that we always had growing up.
Like Visine.
We'll get to Visine next, young lady. Okay. This is basically Visine for your nose. And
oh, right.
It is. So Afrin and a lot of the other nasal sprays, the non-steroid nasal sprays, how they work is when you spray them in your nostrils, they'll get in there and they'll shrink down all the blood vessels, and so that's how they get that congestion down. But they're not actually treating the cause; they're just treating the symptom, and so it gets all that. It causes all that constriction, and then as it wears off, those blood vessels come back, but each time they come back a little bit bigger. So then you got to use it again, and then it shrinks it down, and then they come back a little bigger. So if you are going to use these products, we recommend that you don't use them for more than 3 days, or you can get what's called rebound congestion, where your symptoms actually get worse the more you use it. They've had such good marketing for the last 50 years that everybody thinks, oh, I have congestion, I should use Afrin. there's much better alternatives, much more effective alternatives, such as our nasal steroids. So, yeah, so it's not that we can't use them, but if we do, we have to limit ourselves to 3 days. And this realize that we're not quite getting as much benefit from them as we think. So kind of the last staple with allergies is a nasal spray. Especially, or just a saline nasal spray. Just helps keep the nasal bed moist, again, help catch those allergens. That's why our nose runs when we have allergies, is we're producing more mucus and stuff to try and catch more of those allergens before they get a chance to make it into our sinus tracts. So keeping the nasal bed moist with a like an ocean nasal spray or just a saline nasal spray is a great thing to do. You can use these along with like the nasal steroids. So since you're only using the nasal steroid once a day, we can use this throughout the day to help help with sinus congestion as well. This will help the coolness. Sometimes has a mild constricting effect or can help with the congestion, and again just helps with allergy symptoms.
Okay.
Also be a good point to maybe do the proper demonstration of a nasal spray. Oftentimes people just think you just put it in and squeeze and go. Sure. What typically happens is as people are doing a nasal spray, they tend to want to point it in, and so most of it gets on your septum versus up into like your sinuses and the areas where it really needs to. So it's a little awkward, but oftentimes I'll recommend using what's called your contralateral hand. So to go in your left nostril, you use your right hand. You plug the opposite nostril and then you come over the top and then you do the spray. So what that does, it aligns the bottle with your septum, so you're going straight up, and then the spray is going to get up higher and you'll get it where you need it. So it's a little awkward at first, especially when you're going with your non-dominant hand trying to get the spray where it needs to go. But that can just be a little trick to sometimes make sure that we're getting the nasal spray where it should be.
Okay, awesome. So last year, I don't really get allergies, but I did get them last year, I think just because it was, from what I heard, like an extremely bad year. And so I just went into the pharmacy and I didn't ask any pharmacists anything, but I just got Visine because I thought that that's what you should get. But apparently you have other information for me and everyone else who uses Visine for allergies.
So yeah, well, Visine is kind of like that Afrin. So what it does is it goes in and shrinks the blood vessels. So we've all seen the ads, and it says right on the box maximum strength, and for allergies and redness reliever. I usually try to avoid anything that has a redness reliever in it. The reason is that exact same thing. It shrinks the blood vessels, makes the redness go away, but as the medication wears off, those blood vessels are like, we didn't like that, so we're going to fight it, and they come back a little bit bigger. And then we use it again, we shrink them down, they come back a little bigger. So with extended use or overuse, your symptoms of redness and irritation can actually get worse. Okay. So Visine, again, not a bad product. Not a bad product for what it's designed to do. We just need to make sure that we're using it appropriately and not necessarily using it to treat our allergy symptoms per se. So Visine, not my first choice. What I suggest is, again, this is Zatador. Zatador is an anti-inflammatory, antihistamine allergy drop. So what this one's going to do is it's actually going to fight the allergy for you. So the itching and the irritation and all of that, this one is going to be the best. Nice thing about it is it's a twice a day, so it's long lasting. Visine, again, is kind of like a 4-hour deal typically, but this Zatador is a 12-hour relief with it. So 1 drop in each eye every 12 hours, and it really is going to work faster and better than anything else we've got out there. Nice thing about Zatador.
This is the...
Boom, you got it. There's a generic for it. So typically for less than $10, you can get a great allergy medication that's gonna treat the cause, which is the inflammation and the allergies and the irritation. Get that pain, itching, burning gone, and keep it gone for 12 hours or even longer. Great product. Again, used to be available only by prescription. Would have been well over $100 before. Now we can get them for $15 to $20, and cool. And 1 bottle will last you quite a while. So Also, something that's very important as your eyes are irritated from allergies, that sort of thing, that they can just to use a simple lubricant eye drop, just something to keep them moist, keep them hydrated, just to kind of helps soothe and comfort the eyes. Sustain is a fantastic one, but there's also just generic, just artificial tears. Anything like that is going to be fine. Again, just to keep the eyes moist and keep them hydrated.
So you mean like in between when you do the drops?
Mm-hmm. Yep, you can use it during the day while you're using the other ones. And the nice thing is with an artificial tear, you can typically use it as often as you need, every 1 or 2 hours. This is kind of like the saline nasal spray, but just the version for your eyes. Again, just to keep everything moist, hydrated, cool, and comfortable. Okay. We do have a natural or homeopathic option as well, irritated eye relief, just to try and get in there, get the inflammation down.
So is there anything else that you want to tell people, let people know when it comes to allergies and treating them?
So, oftentimes when you're coming into the store and you see the allergy section, I mean, it's just overwhelming. There's all the different brands and there's the different generics, and I mean, it's 10 feet of just, oh no, what do I need? And you're just trying to read what's on the box. Oh, this says it treats this, this, or this. Come see the pharmacist. We'll gladly go through what your symptoms are, and we'll get you which one you need. So
okay, great. So if you found this information useful today, please share it with your friends who you think might find it useful as well, who may suffer from allergies or have family members who suffer from allergies. Again, if you have questions or they have questions, make sure to talk with your local pharmacist and they'll help you. You can find your local pharmacist at montanafamilypharmacies.com. Also, if you like this video, you can find more information like this on our Facebook page, our website, and YouTube at Montana Family Pharmacies.